Hi, welcome to Full Face Orthodontics. Come on in. My name is Dr. Mahony. I'm the CEO of Full Face Orthodontics, and I know a lot of the patients are worried about the coronavirus. I just want to share with you what our cross-infection policy is. Any handle that we touch, including the main door, as you enter, a nurse sprays it down. You'll enter one of my 6 locations, and normally you will sign your name in the computer to let the staff know you've arrived. What we ask patients to do is to use the hand sanitizer as soon as they check in, and then this will be wiped over by the nurse. When you're called into the clinic, you can see that the clinic has a special covering and a door that puts the pressure out so that we don't have more microorganisms coming inside. Any door handle that's touched, such as this, is wiped over. Then come inside into the autoclave room. So it's a bit noisy here because all the autoclaves are working. Anything we use in the mouth is either disposed of or autoclaved in a steam autoclave as per Australian Dental Council regulations. When you come into the clinic, the chair, the light that we use is all wiped down between patients. So in actual fact, my practice has always been clean, but now we've taken even extra precautions. I'm not kidding, you can literally eat off that chair. That's how good it is. Now come over here, and I wish this is something that I could see in places like hairdressers, at restaurants, etc. We don't see this, but we see it here in these clinics. So the safest place for you or your child to be is actually in a dental clinic, because our levels of cross-infection control are up there with that of a hospital. So when we finish a patient, our gloves comes off, change our mask. We then wash our hands. Now, all my staff are instructed on proper hand washing technique. What does that mean? They literally, when they're washing their hands, they're counting 1 100, 2 100, 3 100. 20 seconds is what it takes to properly wash your hands. After washing the hands, the most important thing is to dry them. So here, you've got to dry very well, because that also is another chance of cross-contamination. What do you want to do after you dry your hands? You want to make sure that we put in hand sanitizer, and then we dry our hands. And this happens nearly 30 to 40 times a day for every patient, for every doctor. So please rest assured, we at Full Face Orthodontics take our cross-infection policy very seriously, and I don't think anyone needs to be afraid to come for their orthodontic appointment. One good thing about orthodontics compared to surgery, etc., is that the contamination risk is greatly reduced because of the type of procedures we do. If you have any questions, feel free to contact myself, any of my doctors, or any of my staff. Other than that, we look forward to operating during this period of time, and we hope that everyone gets on top of this by normal cross-infection procedures. Thank you very much.